I think we're dancing around maybe the fact that you are the president of the OARSI. So I think your induction into the OA world has been pretty solidified. What inspired you to get into OA research? Was there a particular event, or did you just sort of fall into it with how you did your schooling, or how did that happen?
Yes, I did my PhD in a cartilage physiology lab. So
Okay.
when you work with cartilage, when you work with a group that knows all about chondrocytes, there's only one direction you can go.
Right.
So you can keep it purely biological, you can keep it purely physiology, or you can really start to network with the relevant audiences that actually are the end users. You need to think about your research. Who does your research benefit?
Mm-hmm.
And of course, at the time, in those early years, I wouldn't say I was an osteoarthritis researcher. I used to call myself a physiologist. I used to go mostly to FACET meetings, experimental biology meetings. I used to go mostly to physiology meetings. And gradually I got seduced by the OA side, So I've been going to OA meetings mostly recently, and fewer physiology and biological science meetings. I'm leading two projects, and these two projects I'm leading in Lithuania in my research institute in Vilnius. And one of them is about biosensors and development of the next generation biosensors. So right across the road in our Cancer Research Institute, we've got colleagues who are using small nanoparticles that emit light. And these quantum dots are quite topical and sexy in the fields of nanotechnology and cancer research. So one of the things we're doing is to try and see if we can develop immunoassays based on quantum dot conjugated antibodies.
Okay.
So you probably know most antibodies for immunoassays are either enzyme conjugated or conjugated to fluorescent,
Right.
reporters. But there's now a new generation of antibodies with diamond conjugates, and these are synthetic diamond, and these shine really brightly. And there's the quantum dots. The beauty of the quantum dots is that there are quantum dots with different colors, so you can potentially develop multiplex assays.
Right.
So one of our projects it's a very high risk project, and we're trying to develop both in vitro immunoassays and immunohistochemical if you like, extending the sensitivity of immunoperoxidase techniques using quantum dot technology. So that's one project in Lithuania. Another project is simply asking fundamental question: what is the impact of cardiovascular drugs that are used in hypertension on joint cells, chondrocytes, and what is the impact on chondrocytes, stem cells, and calcium channels in particular? And we're studying those. So that's an electrophysiology project. It takes me back to my roots as a physiologist. And before you ask me, do you do the electrophysiology yourself? I'll say, well, that's a very, very dark art. You need to get specialist people to help you. So we've got a team of cell culture experts. We've got clinicians in the orthopedic department providing us with samples, and electrophysiologists measure electrical activity of chondrocytes and stem cells.
So you have so many connections, as not only in just OA, but on both the research and the industry side of it. And so tell us a little bit about what you're working on currently, and sort of how you've been able to sort of be this international figurehead of OA and still, like you said, follow your passions on the research side of it.
To be honest, I wake up in the morning and I think I know nothing, and I think I need to learn, I think I don't know enough people. I don't know. Well, actually, I do know the right people, and I've been very fortunate to be mentored by the previous OARSI leaders. Some of the previous OARSI presidents have been wonderful mentors to me. The mentorship that they've provided has been invaluable. So I always look up to those senior colleagues for inspiration, for direction, and they really do help you when you come up with a challenge, and you need to consult with someone. It's so nice to just pick up the phone or organize a Zoom meeting, as we are doing right now, and have a conversation. And I find that everybody's always available. And that's been the interesting thing about the last 12 months, the availability. So internationalization is very important for OARSI. So just reflecting back to my very first meeting, it was only 300 or 400 people. So, and there were fewer young investigators. I remember that distinctly. And I think there were only 2 parallel sessions. Yeah.
Wow.
So, and it was a small meeting. I actually remember going to the convention center, and this is a funny story from 2003 in Berlin. I was dropped off by my cousin, so I couldn't afford the hotel. So I was staying with a cousin who was studying at Humboldt University in Berlin. Okay. So I afforded the flights, which is relatively inexpensive, from the UK. And I saved on the accommodation, staying with my cousin, and she dropped me off at the convention center. So I remember being dropped off, and she said to me, "What time should I pick you up?" I said, "Well, we should be done by maybe 5:36. We can go to dinner." And of course, I didn't know a soul. Didn't know anybody. And then she said to me, "Actually, are you sure I'm dropping you off at the right place?" I said, "Yeah, this is the address." She said, "Look at the banner." So I looked up. There was this huge banner. It said Euro Erotica 2003. And there was like a tiny little logo for OARSI to the bottom right of it. So there were probably 10,000 people attending this European Erotica conference, and 350 people attending the OARSI conference in this side building next door. So it wasn't the biggest meeting in town, but it certainly was the more interesting meeting. I think OARSI has the capacity to grow. And the international element is very important for us, because given our international flavor, there are still parts of the world that we can reach. Yeah. And I think we can have a greater impact in South America, Sub-Saharan Africa, and China and Russia. There are some countries that we've had very little involvement. We need to increase that. But of course, OARSI has always had a lot of strong involvement from North American colleagues, European colleagues, and also this Australian horde who are always there. So it's nice to see the regular people, but we do need to think about the global burden, because it's probably underestimated. There are probably many more people than we have estimated to have osteoarthritis, and there are parts of the world we have got very little data on.
Thank you so much for coming on and chatting with us. And I think you are such a wealth of information, a wealth of knowledge, and just such a friend to the Arthritis Foundation. And you've kind of have your foot in every door in the best possible way. You're working on science communication and prevention, but also cutting edge technology. And so as always, I'm left in awe of our conversation. So thank you.
Thank you very much for the opportunity to speak to you. And I wish you and my colleagues at the Arthritis Foundation the very best as the organization grows and adapts for the purpose of serving its stakeholders and its patients in this crazy new world that we find ourselves in. And I think the Arthritis Foundation has done really wonderful things for patients out there with arthritis. So thanks, colleagues at AF, and thank you, Emily, for the opportunity to speak to you.